physical examination. In general physical examination, we look at pallor, icterus, cyanosis, clubbing, lymphadenopathy, generalized edema. So when you look at it, pallor, we'll have to know at least 2 to 3 causes for each of these and how to examine. So pallor is paleness of skin and mucous membrane, sight, conjunctiva, tongue, oral mucosa, palmar crease, nail bed. Uh, in which conditions do we look see pallor? Anemia, shock, left heart failure, hypothyroidism, hypopituitarism, hypogonadism. Next, we have icterus. In icterus, uh, we see yellowish discoloration of skin and mucosa membrane. The sites which we look for is sclera, palm, sole, oral cavity. There's increased bilirubin, more than 2.5 mg per dl, and this is seen in jaundice, hypothyroid. Jaundice is the first answer which you should know when you say when they ask causes of icterus. Then again hypothyroidism, hypercarotinemia, phenol nitric acid exposure. Next, cyanosis. Cyanosis is the bluish coloration of skin and mucous membrane. Here there is increase in deoxyhemoglobin, that is the reduced form of hemoglobin, and there is even increase methemoglobin. The increase in deoxyhemoglobin is more than 5 gram percent. The causes of cyanosis, central causes include 5Ts and 2Es, that is tetralogy of Fallot. Then we have truncus arteriosus, then we have tricuspid atresia, then we have transport of great artery, then TAPVC. In 2Es, we have Epstein's and Eisenmenger syndrome, and for other causes includes asthma, COPD, carpal pneumonia, pleural effusion, high altitude polycythemia. Then peripheral causes of cyanosis include decreased cardiac output, cold, frostbite, Raynaud phenomenon, vasoconstriction, artery venous obstruction. In mixed form of cyanosis, it is left ventricular failure. Then clubbing. Clubbing is the bulbous enlargement. There is increase in connective tissue and there is loss of onychomycal angle. So when we look at the causes, we have respiratory causes such as bronchogenic carcinoma, bronchiectasis, empyema, lung abscess, asbestosis, cystic fibrosis. In CVS causes, we have infective endocarditis, cyanotic heart diseases, Eisenmenger. Then in GIT, we have inflammatory bowel disease, both Crohn's disease and ulcerative colitis. And the causes of unilateral clubbing are aneurysm and coarctation. Next, lymphadenopathy. There is involvement of more than 2 non-contagious lymph node groups. Lymphadenopathy is seen in TB, secondary syphilis, HIV. These are the common causes which you know. Then infectious mononucleosis, toxoplasma, histoplasma, CML, CLL, lymphoma. Then it's seen in SLE, systemic lupus erythematosus, rheumatoid arthritis, Sjögren, Kawasaki, sarcoidosis, amyloidosis, hyperthyroidism, NSAID, beta blocker, corticosteroid drugs used. And finally, the edema. Edema is nothing but the accumulation of fluid in interstitium. The types of edema are pitting with rapid recovery, less than 40 seconds, pitting with slow recovery, non-pitting facial edema. And the causes mentioned below: burns, kwashiorkor, nephrotic liver disease causes pitting, rapid recovery, pitting and slow recovery, hypertension, congestive heart failure, DVT. Then non-pitting hypothyroidism, filariasis, Graves, breast cancer, malignancy, and facial edema, classic nephrotic, hypothyroidism, and allergy.